Here's the thing about hypothermia and cold exposure is that children are at a greater risk, especially infants and toddlers. This is largely because children have the lack of awareness. They tend to get themselves in a little bit of trouble because they prioritize having fun and don't pay attention to their environments. But physiologically speaking, children tend to have a higher body surface to mass ratio. So there's essentially more room on their bodies to have heat loss. And infants can't really shiver the way adults can. Parents and caregivers may wonder, what is the right temperature? What's too cold? And it's really hard to predict a specific temperature because after all, children live and thrive in so many different types of climates. Parents really should be paying attention to instead is exposure, not only to the elements in the cold, but how covered up your children are and how long that exposure is going on for. Some of the early signs of hypothermia are not so apparent. They could be things such as shivering, cold, pale skin, and then that could progress to more insidious symptoms such as confusion, slurred speech, or drowsiness. And at that point, hypothermia can be extremely dangerous, in some cases fatal. You want to make sure that you're dressing your children in layers. It's easier to take layers off if kids get too hot after all. Also, make sure you're covering those limbs with adequate shoes, high socks, gloves, and a hat, potentially even a neck scarf depending on the weather, because children tend to lose body heat from their extremities, especially their heads, at a disproportionate amount. And especially be careful if there's a situation where children might get wet, because water will take away heat from our bodies way faster than we can estimate. Dehydration and poor nutrition can also increase anybody's risk of hypothermia. So it's important that everyone is adequately hydrated, eating nutritious meals before and during any cold weather activities. The safest way to take care of anyone, including a child, infant, or a teen who has prolonged cold weather exposure, if you're concerned about hypothermia, is to gently move them to a warmer place, remove any wet clothing, and prioritize warming up their head, their neck, and their chest first. If they're conscious and talking, it's also a good idea to give them some warm liquids, but please don't ever give warm liquids to someone who is confused, excessively sleepy, or unconscious. And if you have any concern at all, please seek immediate medical help or just call 911. Sometimes, surprise, surprise, toddlers and kids will have these symptoms and continue playing. They will be shivering with cold fingertips, cold skin, and they will still want to play, which is why it's important for parents to regulate and say, hey, let's put on some layers or potentially come back inside and warm up.